Dr. Taki, you raised a very important point and I totally agree with you. I just want to say, when we communicate to a patient that there are probability of some percentage of complications, and a complication happens, have you ever wondered that for some doctors, the patient will complain for a small complication, and with other doctors, they will not even complain if there has been a major complication.
Yes.
The issue is, in addition to what Dr. Taki said, the issue is communication. If you are able to communicate to the patient that this complication has happened and these are the steps that we took to prevent that complication, it still happened, this is what we are going to do to take care of you, many a times the patient will take it in this stride. But if you have done a complication and you have not communicated it well, then the problem arises. हमेशा complaint तब होती है when there is an anger response. अगर anger नहीं होगा, कोई complaint नहीं होगी. जब आप patient की family को और patient को angry करते हैं, उसके response पे complaint आती है. There are exceptions to the rule as well. But many a times this is the case, so we have to communicate properly to the patient and the family about what has happened.
So, final word, madam, just we have to take time to change the practice. Our communication is now the key to success for our successful practice. So, thank you so much, ma'am. I know we have some scenarios, some clinical scenarios which we every day come across in our operation theatres while practicing anesthesia and ops. So, we have some scenarios which we'll be discussing here. So, we move towards our first scenario. In our preoperative assessment area, many of patients are confused between spinal and general anesthesia. They leave the choice to anesthesiologist. I myself have encountered it कि जी मैडम आप decide कर लें हमारे क्या बेहतर है, even spinal जो आपको अच्छा लगता है वो करते हैं. तो ये बड़ा एक difficult सा situation हो जाती है कि sometimes surgeon demand us कि जी आप will do a directive counseling to the patient and counsel her कि जी GA best for you and your baby and we want to proceed in GA. ये mostly surgeon choice होती है. And we, just to keep the situation safe and everything to go smooth, we counsel the patient accordingly. अब unfortunately ये कैसा दिन है कि हमने counseling कर दी patient की for GA और the same day we are हम लोग एक ऐसी situation में फंस गए कि patient में anesthesia complication, obese patient में aspiration हो गई है, दांत टूट गया है, कोई ऐसी complication develop हो गई है general anesthesia की जो कि patient के लिए बड़ी unacceptable है. क्योंकि patient तो हम अपना आप हमारे हवाले कर चुकी है कि जी डॉक्टर साहब आप मेरे बेस्ट इंटरेस्ट में जो करना चाहते हैं कर दें. हमने GA दे दी है और पेशेंट जो है ना शी हैज डेवलप्ड अ कॉम्प्लिकेशन ऑफ जनरल एनेस्थीसिया क्योंकि ऑब्वियसली देयर आर द प्रोसीजर रिलेटेड कॉम्प्लिकेशंस ऑफ एनेस्थीसिया टू द प्रेग्नेंट फीमेल एंड द फीटस एंड टू द बेबी. ये चीज़ इनएविटेबल है. सर अब पेशेंट ने मैं परसू कर दिया कि जी आपने तो हमें कहा था कि GA सेफ और नहीं और हमारी तो जी ये प्रॉब्लम हो गया क्रिएट हो गया डिलेड रिकवरी हो गई है वेंट से नहीं उतर पा रही है व्हाटसएवर. तो इस सिचुएशन में हाउ कैन वी प्रोटेक्ट आवरसेल्फ मेडिको लीगली या फिर हम SOPs पे ही चलेंगे अगर पेशेंट हमें दे रहे हैं तो हम स्पाइनल की तरफ ही जाएं क्योंकि अब वर्ल्ड वाइड तो स्पाइनल ही रिकमेंडेड चॉइस है एनेस्थीसिया की फॉर प्रेग्नेंट फीमेल्स. तो सर इसमें थोड़ा सा गाइड करें जी सर. Rashid sir, you want to add something sir kindly?
Thank you. Okay, very interesting question again. Spinal versus GA.
सर्जन चॉइस GA फंस गए हम कॉम्प्लिकेशन हो गई हमसे और सर्जन की चॉइस से GA दे दिया था.
In developed world, ठीक है, spinal versus GA choice of anesthesia.
बिल्कुल सर.
But आप UK rules are applicable in Pakistan as well. ये क्वेश्चन कर रहे थे. The protocol guidelines बनी है, आप भी bound to follow those. ये पहले ये मेरा क्वेश्चन सबसे एक दूसरी बात ये हमारे अपने कोई गाइडलाइन पाकिस्तान की बनी नहीं हुई.
एग्जैक्टली.
गाइडलाइन रिपोर्ट शुड बी. मैं कहता हूँ कि इसमें कोई बहस नहीं होनी चाहिए. It should be a mutual decision. The choice should be, the choice technique should be the one which is depends on the indication of surgery, urgency of surgery, acceptable by the patient, and it creates least depression to the fetus, and finally it provides optimal surgical condition to the surgeon as well. किसी गाइडलाइन में सर्जन अधिकारी नहीं है, तो होना चाहिए जी. He is a big party, major party. अगर वो कहता है मैं comfortable नहीं हूँ, तो मैं सोचता हूँ ठीक है, then he should take responsibility. अगर mishap होगा, तो फिर surgeon should
responsibility surgeon's end पे आ जाएगी.
काम forward कि मुझे मैंने कहा था.
मैं पैसे चलते आपके आप दोनों हैं.
इसमें ऐड अप कर दूं जैसे सर ने कहा है तो डिसीजन of anesthesia, choice of anesthesia is basically the domain of anesthesiologist, not surgeon. But if due to some reason अगर ये problem arise करती है, तो then you must consider that or there any risk of general anesthesia. If there or risk, patient is force coming, chances of aspiration, or patient is hypertensive, something like that.
Sir, sometimes unexpected आ जाता है, difficult day पे आ गया, नहीं गई क्यों?
So then you must
Hypoxic
explain
नहीं
it.
हो गई मदर को, जी
It
यही
should be explained to surgeon as well to attendants.
फिर अगर वो कंसेंट दे रहे हैं तो फिर हम लोग जी की तरफ चले जाए.
We are having this problem, but
Okay.
overall I think जैसे हमने कहा है कि it's basically a teamwork and
Exactly.
one should not blame the other team कि जी ये surgeon ने decide किया था, so I am not taking this responsibility. Responsibility, ultimately the responsibility of general anesthesia lies over the shoulder of anesthesiologist in any case.
Huge responsibility. जी
डॉक्टर
मैडम.
सुनील ने बड़े अच्छे टाइम पे अपनी स्टेटमेंट वापस ले ली है। मैं कुछ कहने लगी थी तो बड़ा ही अच्छा कि आपने आपके अपने आप में बहुत अच्छा हुआ। I just want to say कि it is not about the surgeon or the anesthetist. It is about the patient.
Yes.
The primary thing is number one, what is appropriate for the patient, and number two, I would say, what are the wishes of the patient.
Okay.
So, and then again, as I said before, it is a process of shared decision making. So, if let's say spinal anesthesia is appropriate for a particular patient, I'm sure no surgeon will come and say कि नहीं इसको तो ठीक है. So ऐसे नहीं होता. और अगर ऐसे होता है तो then the surgeon might have their own reasons, which the anesthetist needs to understand and form a joint team. So let's say there is a complication with any one of the types of anesthesia. The responsibility, obviously, the person who has to answer is the anesthetist. But if the anesthetist has taken all the opinions into consideration and then taken an individualized decision in the best interest of the patient, I think the anesthetist is in a good place. So joint decision making करें, जो patient के best interest में है उसको watch करें. और जो patients कहते हैं हम sure नहीं हैं, जब आप उनको detail में discuss करें, they always have a method of choice. It is not that they don't have a method of choice. And one more thing that is for my gynecologist colleagues actually, that the gynecologist during the clinic when they are doing the antennates of the patient, they must discuss the type of anesthesia if it's a planned procedure. Because then the patient knows the pros and cons beforehand, and then they come to you with a pre-set mind makeup, and then they can be more effective participants to the CM.
Yes. Yes, sir. Sir, Ryan.
Cannot help me speaking on this issue, I'm sorry. But are we talking science here, or are we talking about what we call as realities of life here? The science, there's overwhelming evidence that spinal anesthesia is beneficial to the patients. But if there is evidence to the contrary from the side that advocates general anesthesia, anesthesiologists who advocate general anesthesia, then they should be coming out with that evidence. We certainly know that the effect on the patient's parturient are minimal. The issue of maternal hypotension has largely been taken care of through whatever the therapeutic approaches are. Effect on the baby, the jury is still out, but there's a very strong advocacy on part of the spinal anesthesia advocates who say that there is a significant risk of developmental whatever, so your kid may not end up with the A classes and get admission in an Ivy League at university. Till the time we know that, I would be the one who would want to take responsibility for that child not getting into a Harvard University with a scholarship. So that would be my choice. Once again, वो बात होती है कि surgeon, with due respect, the evidence says that tons and tons of surgeons are doing it under spinal anesthesia and are perfectly comfortable with that.
Yes, sir.
So anyone who is not has to once again come and say, this is my reason for not being comfortable with spinal anesthesia.
Dr. Taki, how would you respond to a patient who wants a general anesthesia?
Then there's an issue of consent now. So because the discussion got distracted between the sadist and sin. You said it right, that ultimately it's the patient who decides. So if the patient still says, my choice is general anesthesia, and I don't see any risk, particular risk in terms of a difficult area or anything, then it is my duty to agree with that. But it has to be an informed consent, wherein the patient is informed about the two choices.
Thank you so much, sir.
One sentence which I would like to add over here, that if you are summoned by the ethical commission, you cannot quote this sentence. The anesthesia, general anesthesia was demanded by the obstetrician or surgeon.
Okay,
You
sir.
have to defend it by
Training
yourself.
concepts. Thank you. Thank you so